Hi, I'm Dr. Chrissy from Stamm Dental Wellness, and I just have a lot of patients that are asking me, is it safe to get adjusted when I am pregnant? So my lovely patient Lindsay volunteered to come and get adjusted, and I'm just going to show you some of the things that I do differently for pregnancy that keep it really safe, really gentle, but also still really effective for back pain and also for getting the baby in the right position for the best labor and delivery possible. So first and foremost, we use pillows. So Lindsay, go ahead and stand up for me. These pillows have big holes in the center, and as you grow, I change and do the different layers of pillows. She is getting closer to the end, so we're doing the double decker. So come on up. Her belly's gonna go right there in the middle, and then we have a special face pillow too. Good. And Lindsay, does that feel okay?
Mm-hmm.
Okay. So the first thing I check is just tension in the legs, and that you can see one of her legs has a lot more tension than the other. And so a lot of times that has to do with how the pelvis is rotated. So then I work more massage at first, and work that slowly that direction. And we just correct that sacrum and that rotation. And nothing is doing any big twisting. It's more just small movements to get that to correct. And then we check it again, and it's even. And then another question people ask is whether it's safe to be on your back. What I'm showing you today is just how I assess the back, but I also work on your upper back and neck. So you can definitely be on your back for a little bit as long as it doesn't create dizziness. All right, go ahead and come onto your knees. Just gonna help you through there. All right, so let's go ahead and lay on your back actually.